The COVID-19 pandemic really exacerbated loneliness and really impacted people's mental health. We know from survey information that a third of Canadians said they experienced severe loneliness, and half of Canadians said that their mental health worsened during COVID-19 during the pandemic. And we know that this is also worse for communities that experience systemic forms of marginalization and vulnerability. So folks who are Black, Indigenous, racialized, living on low incomes, older adults living on their own, people with physical disabilities and disabilities of all kinds. So for us, the problem was, how do we meaningfully address social isolation and the mental health, particularly for communities that were most impacted by COVID-19. Social prescribing is connecting someone with their community. It's connecting someone with non-clinical supports to support themselves, their interests, and what they need. So we're talking about making a referral for a client to an exercise program, a cultural connection group, a meal drop-in, a music program. Those non-clinical supports can be deeply meaningful in impacting people's mental health and well-being by really strengthening and deepening the connection they feel to their community. So one of the key questions in social prescribing is what matters to you rather than what's the matter with you. For this project, we're supporting 28 communities across the province of Ontario with implementing social prescribing in their community. That could be a community health center or a nurse practitioner-led clinic, but it is supporting those centers in hiring a link worker or a navigator. It's someone who's able to take a referral, meet with that client, ask them about their goals, their interests, what they're passionate about, what they might want to be doing, and then do the work of connecting them to that resource in the community.
The magic that comes with the social prescribing is that we're able to have really clear referral pathways. We're able to document in the electronic medical record some of those impacts, and then we're able to track how the client is improving and also how the health system is improving.
We have an engagement coordinator who has been meeting with every project site as part of this project to really listen about what they're doing in their community, what they would like to implement, and then to support them along that pathway. And then we're also developing some online learning tools that will be available not just for folks who are participating in this project, for anyone across Canada who's interested in equity-focused social prescribing. Every single project is unique, that each of the 28 communities is running a social prescribing project that makes sense for them and that looks specific to their needs. And that self-determination is key in community self-determination, being able to decide what they need and what their needs are, and that the Alliance is able to support them in meeting those needs.
Sometimes it takes that an entry point and a bit of a friendly handover to get people to connect to some of those programs. Like, you see people blossom because they're coming to one group, and then it gives them a little more confidence and they're ready to try something new. Maybe I'll do a computer course. Maybe I'll get back in the workforce. Like, you can kind of see that journey. So the outcome is obviously like healthier people. So people living in great health, and defining that in a really broad way. So people having a sense of purpose and meaning in their lives. How can you put a price on giving someone this sense of belonging in a community?